Hari Om. I am Rudra, yoga therapy student. Here I am going to explain a few points about the condition cervical spondylosis and the importance of yoga therapy as treatment. We humans are very proud to have a straight backbone compared to any other animal. So it's our primemost responsibility to keep the spine healthy. But due to our lack of attention, we end up in spine injuries which causes cervical spondylosis. Now let us see what is cervical spondylosis. It is a general term for age-related wear and tear affecting the joints of the neck. Physiology. This condition usually appears in men and women older than 40 and progress with age. As we grow older, bones and cartilage of the backbone and neck gradually starts to form an irregular bony outgrowth. See what are the symptoms of this condition. Stiffness and muscle spasms, pain in the shoulder and arm, numbness in the hands and legs, difficulty in walking, dizziness, headache, grinding sound when you move your neck and head, arms, etc., and lack of coordination. All these are the symptoms of this cervical spondylosis condition. Let us see the causes for this condition. In the current scenario, as everybody knows, because of this pandemic situation, all have to work from home and most of the activities and studies happening only through online. So full time sitting in front of the computer versus this condition. A person is more likely to develop spondylosis if he had a previous neck injury. And as he gets older, the spine and cervical discs lose its elasticity, also stiffening of the ligaments connecting neck bones and muscles. Let us go through what are the tests available for this. The symptoms and history along with an examination will suggest a cervical spondylosis, and other imaging tests used are checking the neck flexibility, neurological exam, neck and spinal x-ray, CT scan and MRI, myelogram are the available tests. What are the available treatment and their limitations? Without treatment, the signs and symptoms of cervical spondylosis may decrease or stabilize, or they may worsen. The goal of treatment is to relieve pain and prevent permanent injury to the spinal cord and nerves. Some mild cases of cervical spondylosis may respond by wearing a cervical collar. By wearing this, what happens? It helps to limit the neck motion and reduce the nerve irritation. Also, taking non-steroidal anti-inflammatory drugs for pain relief. If these two conditions doesn't help, then we can opt for surgery. That if the conservative treatment fails or if the neurological signs and symptoms such as weakness in the arms or legs are getting worse, the patient may need surgery. The surgical procedure will depend on the underlying conditions such as bone spurs or spinal stenosis. Risks of this procedure include infection, a wear in the membrane that covers the spinal cord at the site of surgery, bleeding, a blood clot in the leg, etc. we have to consider. And by doing the surgery also, it may not solve all the problems of cervical spondylosis. Here, the yoga treatment will do a great help. How the yoga will help to cure this condition? We can begin with the simple yogic stretching exercises like a shoulder and neck movement. Then also like rotating the neck movement, eye exercises we can do, neck and upper body, sideways twist. All those will help to release the stiffness and to reduce the pain. And we can do the breath and body movement coordination, Sukshma Vyayamas and all will facilitate the healing energy throughout the body. And of course, asanas will help a lot. What are these asanas? Let us go through. The important few asanas are listing here. Those are Matsyasana, fish pose, What happens when we do the Matsyasana? It offers the strength and spine flexibility, and the complete vertebral column is benefited. Long hours of sitting in front of the computer or continuously operating the smartphone cause stress and strain. This pose is very helpful to relieve that stress. Now when we do Bhujangasana, what happens? In this particular asana, the backward bending of the spine helps to improve the flexibility. It is a good measure to remove the stiffness of both the neck and shoulder region. This pose also expands the chest and strengthens the spine. Now we will see Makarasana. It is a very good pose to help to release the stress and relaxes the entire spine. Now we will go through the Ardha Matsyendrasana. It is a half spinal twist. This pose stretches the neck and shoulders and also energizes the spine by twisting it to the correct alignment. It corrects the alignment of the spine. One more asana we will go through, the Dhanurasana. This asana stretches the entire spine and stimulates the neck. One more is Marjarasana, cat pose. This pose stretches the neck and alleviates the backache. One more, Setu Bandhasana, bridge pose. This asana improves the flow of blood to the head, thus relieving the headache. It also stretches the neck. Ustrasana, this asana stretches the whole spine and the whole back, relieves the tension on our neck. Shalabhasana, this asana stretches the whole spine and strengthens the spine. Now, other than this asana, we can do some pranayama also. By doing these pranayamas, the whole energy in the body will be increasing, which will be relaxing for the pain and stiffness of the body. And also we can do some meditation like chakra meditation and Om Japa meditation, which will relax the entire body and calms our mind. Other than this asana practice, we can recommend some dietary habits also, like eating plenty of fruits, green vegetables, salads and sprout, calcium-rich foods, green leafy vegetables, citrus fruits, honey with warm water, and also we must avoid refined foodstuff and junk foods. Finally, we can conclude the session by applying the yoga practice daily. In a regular routine, if we practice yoga, almost 90% of our health issues can be cured. So, how we have to do instead of bringing yoga into our life, bring your life into yoga. Thank you. Hari Om.